I know that most of you are teachers, so may I know like which school are you from? You can type it in the message area. I know like there's some teachers from Cambridge and James Cambridge and um, like which school are you from? Okay. All of you are from the Redwood? Okay, perfect. Let's start. So today we're gonna talk about the ADHD and brain structure. So the ADHD is linked to a link to structural differences in the brain. And there's a lot of study that shows that we have a brain region in individual with ADHD that includes the amygdala, accumbens, and hippocampus. The amygdala is a key in emotional regulation. The accumbens related to reward and motivation, and the hippocampus is important for the memory. So when we do an MRI to a brain with ADHD, we can see that there's a different brain activity related to planning, thinking, and decision making. We have an impairment on those executive functioning, which is related directly to planning and timing and maintaining attention and working memory, and also an emotional control and motivation. So, and we have a different type of reward processing, like there's difference in brain reward network noted. Some studies suggest deficits in reward related decision making. Like we are all seeking for the for a reward, and that's why like sometimes we lose our attention. So how we manage a case with ADHD? There's two types. We can go for therapy and we can go for medication, or both at the same time. So in therapy, the kids with ADHD can benefit from occupational therapy, speech therapy, psychology, and if it's related to if it could be a collaborative approach between teachers and parents and and therapists. And through medication, it could be through medicine. And in many cases, therapy and medication could be at the same time, go along. So the cause of the ADHD are not fully understood, but research suggests that it results from a combination of genetic, neurological, and environmental factors. Here are the main potential causes. Like, usually it runs in the family and it suggests a strong genetic component. Like, it could be one of the parents has the ADHD, and the study shows that that individual with a parent or sibling with ADHD are more likely to develop the disorder. Certain genes related to dopamine regulation may play a role as dopamine is circulated for attention and impulse control. The brain structure and function, it could be like the first thing we're talking about was genetic. Now we're talking about the neurological part. The brain structure and function. There's a smaller brain region in areas related to emotional regulation, memory, and impulse control, such as amygdala, hippocampus, and accumbens. Reduced total brain volume in some individual, and thinning of the cerebral cortex, which affects attention and executive functioning. And it could be from the neurotransmitter imbalances, like dysregulation of dopamine and norepinephrine. Also, it could be environmental factors like prenatal risk, exposure to tobacco, smoke, alcohol, or drugs during pregnancy, or it could be maternal stress or infection during pregnancy. Early life factors like prematurity, premature birth, or low birth weight, exposure to lead or other toxins in early childhood. The diet and lifestyle, like artificial food coloring, preservatives, or sugar, may influence ADHD symptoms. Nutritional deficiencies such as low levels of zinc and omega-3 could play a role in like of the symptoms severity. The psychological factors, while not direct causes, certain psychological factors like the chaotic environment at home or a chaotic or overstimulated environment in a school, neglect or trauma may exaggerate the symptoms in children, and also high exposure to screens and shorts. I want to add something here, before COVID and after COVID, the attention span of an adult before COVID was for 3 hours and a half. And after COVID, where we were all like spending our time on our phone or Netflix or TV shows, the adult attention span reduced from 3 hours and a half to 13 minutes. Imagine like this impact has on on our kids who are highly exposed to technology and on a daily basis, and we feel like this is normal now, whereas it's not normal at all to for a kid to spend like 2 3 hours a day on a screen doing nothing, just like flipping through reels or playing those games without any cognitive demands. So the diagnostic and the criteria for ADHD, to note, it's very highly recommended to have at least 6 symptoms of inattention must be present at least 6 months. So we have 6 symptoms for 6 months. To say that this kid has ADHD or we need like medical attention or therapeutic assessment. So we have like difficulty sustaining attention, frequent careless mistakes, difficulty remaining focused, failure to follow through, difficulty organizing tasks and activity, avoidance or dislike of tasks requiring sustained mental effort, frequent loss of items, early, easily distracted, or forgetfulness. The symptoms of hyperactivity and impulsivity, same thing. At least we have 6 symptoms for 6 months in order to say we might have ADHD. Fidgeting in seats, difficulty remaining seated, running or climbing, unable to play or engage quietly in leisure activities, always on the go or acting as if driving by a motor, excessive talking, interrupting others, inability to wait for one's turn, and impulsive decision making. So we have many types of ADHD. It's classified into 3 main types based on the symptoms. So we have the ADHD inattentive type. It was formerly as ADD, attention difficulties, uh, difficulty sustaining attention in task or activity. He's easily distracted by extraneous stimuli, frequent forgetfulness, such as losing items or missing deadlines, and struggles with organizing tasks and following through instructions. The hyperactivity and impulsive type, it could be like excessive fidgeting or inability to stay seated, talking excessively and interrupting others, difficulty waiting for a turn or engaging in quiet activities, and acting impulsively without considering consequences. ADHD combined type, it could be a combination of both inattention and hyperactivity impulsivity symptoms. The individuals exhibit significant challenges in both areas. So Here are some tips for teachers and the school environment. Like usually, we recommend like teachers to change the classroom seating to proper chair measurement, like seat adaptation or supports. For example, like seats must be in a spot where there's less traffic to lessen distraction. Like it could be in the front, in the corner, or in the second row in the corner, where there's no like people passing by all the time. At the same time, there's no other students on the right or left. So proper seating and chair dimensions, as their legs should touch the ground, and their legs are not hanging like floating in the air, and they're not like slosh. We have to use the cushions and bean bags instead of regular chairs. Some of the time, not all the time. So it depends on each case. So the classroom roles, and we tend to assign them some classroom responsibilities, like door opening, carrying books, putting chairs back, line leader, help the teacher to organize a certain schedule, or uh, f- fixing the schedule with the teacher and be the class lead. So the activity adaptation could be giving instruction one step at a time instead of like giving them an abstract task to do. It's better to divide this task into one step at a time. And the visual support, for example, use of checklist, to-do lists, break and rewards that are individualized, using their interest as a break for a specific amount of time, incorporating sensory strategies and movement breaks, heavy work input, sensory play in the gym, use a weighted item for regulation like moving the desk around while organizing the classroom, or carrying like multiple books to move them from a room to another. It could be through incorporating multiple sensory strategies. And also, it's very helpful to have a behavior plan hand in hand with sensory plan for classroom. For example, it could be working in a team to collaborate a realistic positive behavior plan that coincides with a sensory classroom plan. So our role as OT in a school is to support the student in achieving success, focus on improving skills necessary for learning, play, and independence. And we do assess the child and we evaluate them to identify the strengths of area of need, conduct assessment for motor skills, sensory processing, and adaptive behavior. We collaborate a lot with teacher and parents to determine the impact of disability on school performance. And we develop individual educational plan to collaborate with educators, parents, and specialists to create the goal like needed for this student throughout the year. And we provide recommendation for classroom modification or accommodation. The therapeutic intervention, we help the student in his fine motor skills, in his handwriting, buttoning, using scissors, and other daily activities. We use of adaptive tools and strategies to improve motor coordination. We help them in the gross motor skills like playing, coordination, balance and movement, climbing, jumping, and play that support physical development. The sensory integration, we help the student to manage sensory processing issues and provide sensory tools and strategies to help students focus and engage in learning. So the collaboration with teachers and staff through co-planning and classroom strategies, we collaborate with teacher to adapt learning environment and to suggest alternative way for students to participate in a classroom activity. And we support teachers through educating them on strategies and supporting students with special needs. And we provide professional development on topics like sensory regulation and assistive technology. And the consultation, we work with teachers to address specific challenges students face in the classroom, like attention or social interaction. So we support the social and emotional development for kids, like emotion regulation, like we teach them coping strategies for managing frustration, anxiety, and other emotion through introducing calming techniques and stress relief activities. So the impact of OT in schools, like OT services help students to achieve their full potential in the school setting by improving physical, sensory, and cognitive skills. The OT enhance student overall success in school and beyond. And what's the most important thing is the collaboration. Like without the teachers, the parents, therapists can achieve their goal because we only see them for like 1 hour a day, 1 hour a week, or 1 hour and a half in total. And definitely it's not enough because we are like a clinical setting or a nursery setting or class setting. So we need the help of a teacher that sees the student at least 6, 7 hours a day, and parents who sees them like the rest of the day. So th- like we give like general tips for parents, and later on it would be like tailored for each case. Like we give them we tell the parents to give them like verbal instruction, use core words clearly and slowly, or like visual map or schedule to put it on a fridge or in their bedroom on their desk, and to adapt their physical environment to organize and declutter as much as possible, to have a good lighting, less noise when doing deep or serious work, and to break tasks into simpler activities, and taking preferred breaks throughout the day. Uh, and that's it. Those are the reference for the presentation. It's an evidence-based presentation based on research and clinical practice, and based on our experience with kids for more than 20 years. Thank you all for participating, and I really hope that you enjoyed the presentation. And I'm waiting for your questions. If you have any question related to therapy, to this topic, or any different topic, I'm more than happy to answer your questions. Do you have an ADHD student in your class, or any of like most probably one of us has ADHD as well, and those symptoms applies to them also. So if you have any question related to this, or if you ever dealt with a student who has ADHD, we are more than happy to help you. Does any of your kid like receives therapy? So guys, this is the presentation for today. If you have any questions, I would be more than happy to answer your questions. Thank you all for attending. See.